What's up, guys? I'm here to talk about what you see in the profession of nursing, during your career as a practitioner and what you see in the profession of nursing as a student. You see, those are two different dynamics. They are, closely connected because you can't become a practitioner without being a student. You can't become licensed without having passing your board exams. And so, one thing I want to say is, in as much as you go through gruesome nights of studying to pass your examination, in as much as you have to go through hundreds, if not thousands of hours of lectures, as well as a couple of other things, one thing I'm going to let you know is that the practice of nursing is not so easy. It's one of the most difficult things that you would have to experience, especially during your days as an intern and your days as a senior nurse officer or senior nursing officer. And so I've been a person who has had the privilege of, taking on quite a number of students, on the theoretical aspect of nursing. It's fun. It's not easy too, but when it comes to the practice, especially when you find yourself in, how am I going to put this? Especially when you find yourself in some situations in some departments and some wards, you would know that what you read, what you study, what you write, what you answer is quite different. And that's why it's important for you to go through training as a licensed nurse. Especially if you're a student nurse, the time you have, I would advise you go to your teaching hospitals, go for any form of training as much as possible. It will help. It will open your eyes. It's an opener to these experiences. I have my respect for those who work in these departments. You see those, in fact, in all departments of nursing, I have my respect for you all, no matter your specialty. But when it comes to intensity, when it comes to departments that would most likely burn you out, like those working in the accident and emergency departments, intensive care units, both for pediatrics and for adults, those working in the medical and surgical wards, those in the gynecological wards, the obstetrics and gynecology, it's a different world entirely. It's challenging. You will see deaths, you will see situations whereby patients will ask you to save their lives. You will see situations whereby patients will ask you to treat them before any form of payment because it's an emergency situation. And in that situation, what are you going to do? I've had my fair share in my fresh experience as a registered nurse, and it's not been easy, but it's a fun ride. I'm Nurse Jonathan Nzebuka, a registered nurse and a registered midwife. I'm going to be sharing my journey with you, and I want you to stick around as we go through all this together. See you on the next one.